week on Quadriga, Ebola epidemic, too little, too late.
This health crisis we face is unparalleled in modern times.
The World Health Organization says at least 2,500 people have died from Ebola in West Africa so far, and that the epidemic is set to claim many more lives. The WHO expects the number of infections to continue to double every 3 weeks if desperate governments can't get the situation under control. Leaders in the West now view the epidemic as a global threat. Did the world react too slowly to the crisis? Your host this week, Ali Aslan.
Hello and welcome to a new edition of Quadriga. The Ebola outbreak has been somewhat overshadowed, in the news at least, by events such as Ukraine, Iraq and Syria. But the awareness seems to be rising. US President Obama has pledged 3,000 troops to be sent to Liberia to aid the rescue missions. But the question is, are these efforts too little, too late? What needs to be done? That's my question. Those are the questions we will ask today on today's show, together with these three experts. Welcome to Abu-Bakarr Jalloh, who's a journalist and documentary filmmaker from Sierra Leone. He currently works as a reporter for the African desk at Deutsche Welle. Dörrie is a freelance journalist and analyst specializing in covering resource politics and security issues in Africa. And Judith Vorrath is an associate in the International Security Division of the German Institute for International and Security Affairs. She focuses on challenges for peace building and development in West Africa. Abu-Bakarr, you just returned from Africa. You just returned from Sierra Leone, where you covered the Ebola outbreak. Give us your sense, give us a sense of the mood and what is actually happening there on the ground.
I spent 3 weeks along the border between Sierra Leone, Guinea and Liberia. That's in Jalloh. Basically, that's the epicenter of the outbreak. It started in Guinea and the first patient just crossed the border. So if you go on top of a bit of an elevation in Jalloh, you can see Guinea on one side, you see Liberia on the other side when you are in Sierra Leone. So I spent most of my time there, and the border there is absolutely porous, and for me it was absolutely devastating. What I saw, the news is one thing. Getting the news when you are in Europe, you're already scared and get nervous about it, but then you are there, and then you realize, like, what is actually happening here? What is going on? For me, it was absolutely catastrophic because I lived in a war in Sierra Leone, and I hadn't seen anything so scary.
Is there something that sticks out particularly? Something from your time there?
Quite a lot, actually. One thing that really touched me was I spent most of my time at the MSF clinic in Jalloh, and there was this young man, pretty much my age. He sat in this clinic listening to radio every day, and at some point I even heard him making a phone call on a radio program, basically saying, oh, he was feeling fine. There was all these messages, this misinformation about Ebola, and he was trying to pass on this message. And a couple of days later, he was in the morgue.
Did you fear about your own personal safety there?
Absolutely. I was scared. Personally, before I went down there, I'd worked quite a lot, and so I got sick in the middle of this outbreak. I was there, so it was traumatic for me. I live in Europe, and I live with a lot of fancy stuff around me, because I would say fancy because I wake up in the morning, I can get my cup of coffee. That's precious. And over there, I couldn't. It was hard. Or I would say before, a lot of people don't have access to such thing like that. And finding myself in this kind of situation, and this outbreak was to a certain extent very terrible for me. And yeah, I was absolutely scared.
And quite understandably so. Dörrie, the accounts that Abu-Bakarr just told, and also the other news that we're getting obviously are very disheartening. Now the focus, as I said in the beginning, has been somewhat, and perhaps understandably so, on events in Ukraine, in Iraq, in Syria, and so on and so forth. Do you think that Ebola should move up the political agenda much further?
For moral reasons, yes, definitely so. I think the response by international actors has been underwhelming so far. I mean, now the US has stepped up a bit with its pledge of sending troops and investing money into this crisis. But I think, and you can read a lot about this online, that especially the reaction by the World Health Organization and by other international organizations has been lacking a lot, and this has contributed a lot to the current situation that can be experienced in Sierra Leone, Liberia, and Guinea. So I think it definitely deserves to move up on the international agenda.
And it is now on the international agenda, Judith, at least ever since Barack Obama has made this plea and called Ebola a threat, a global threat, security threat. Do you think that up until now we have not taken this epidemic serious enough?
On the one hand, yes. On the other hand, no. I mean, the problem is it was the first outbreak of this kind in that region. So to be fair, it was a surprise to everyone, and it is very difficult to, for the governments and for the international community to react appropriately, I think, because of that, for that reason. Then also for some time, we didn't really have a clear picture of what was going on, I think. I think numbers have not been adequate in all these problems. So we need to be fair on the one hand, but on the other hand, surely, I mean, Médecins Sans Frontières, Doctors Without Borders have actually, in May latest, said it's out of control. And at that point, I think reaction should have been much quicker and broader. And then it is true that because of Ukraine, Syria, Iraq, there has been a lack of attention probably. On the other hand, I would also say we should not always try to create some kind of direct threat for Western countries. I think it really is about the humanitarian crisis in those countries, and the neighbor countries are threatened as well directly. But we shouldn't overestimate the risk for our countries. It really is about the humanitarian disaster there.
And do you think one of the reasons also why it hasn't really been so much in the focus is that Africa is really not so much in the focus in general in this part of the world?
I do think that's one reason, and I think the sad truth also is that there is this picture of crisis and conflicts and diseases like Ebola being kind of typical for Africa in general. So people do not react the same way. I think that is true on the one hand, but we should also be very, very careful at this point, I think, to say Africa in general is at risk of Ebola or the spread of Ebola, no matter where, because we can see that by now, for example, South African tourism is really already suffering because people are canceling their trips, and in East Africa, Nairobi, companies have actually canceled their flights from Asia, for example. And the point is, the fear about Ebola spread to these areas in Africa is also damaging.
Abu-Bakarr, as we said, President Obama has pledged 3,000 troops, U.S. troops, to be sent to Liberia. They ought to fight, the spreading of the virus there. In particular, he says that health experts are to be sent, health facilities are to be reconstructed. What do you say? Obviously you would welcome this move, but do you think that's too little, too late?
It's a welcome move for sure, and I personally just accept the fact that, I'm happy that the international community has been able to rekindle its effort in the fight against Ebola. I would say it's not too late, but every day you waste time, every day, you don't only double the impact, it's basically tripling the effect of this Ebola, not just on the economy, not just on security, but people are dying. That's what matters to me. The economy is important, but people are dying every day. And my family and friends, when they're sick, they're very, very scared. But I think that Obama decided to enter at this point which is a good thing, which we now see that the UN is meeting, calling for a Security Council meeting to basically look on how to react to this Ebola. We also see the European Council is doing something. Germany is also doing something, which is something that is really, really up. I mean, West Africa population are happy about it. I mean, people are my friends and families that I talk to back home, they are happy that the international community is reacting to what is happening now. I would say it's not too late, but so far, it's not enough.
It's not enough, says Abu-Bakarr, and people indeed, sadly and unfortunately, are dying. Up until now, 2,500 people have already fallen victim to the Ebola epidemic. Half of those most hardly hit is Liberia. Let's have a quick look.
Many Liberians who have been infected feel abandoned by the authorities. Resources are stretched far too thin. People are desperately trying to save both themselves and family members.
I started calling since yesterday. Nobody even cared to even carry a motorbike to say, oh, what is happening here? Nobody.
Many victims have collapsed in the street in front of overfilled treatment centers in the capital, Monrovia. There's no space for them inside. The WHO is frantically training more personnel.
We conducted the training last week. We trained about 300 health workers. And if we can get some more support, we should train some more.
Help is coming from the US and Europe, as well as from other nations in Africa.
I've been there, so I know it, and I'm also ready to go back again and fight the Ebola and help our brothers and sisters.
Money won't be enough to get the epidemic back under control. It will take more clinics and many more health workers. And the situation in Liberia continues to deteriorate.
Well, Peter Dörrie, 2,500 people dead by now. The regions, the country hardest hit, Liberia, we just saw the gruesome pictures. Of course, Sierra Leone and Guinea are also very much affected. Now, these countries already had it pretty hard, particularly Sierra Leone and, of course, Liberia, because they went through a very long and gruesome civil war here.
Yes, so I think the recent history of these countries has definitely contributed to the severity of the current crisis. Abu just told us he lived through the civil war in Sierra Leone, and I think these countries are still suffering from the complete breakdown of their infrastructure, of their health systems, and that makes them susceptible to a disease like this. But I think what is also the case, and this is also true for Guinea, which hasn't experienced a civil war, but there's a tremendous distrust of the civil population, of the people affected by the Ebola virus towards the governments. So you hear a widespread sentiment of people in places like Liberia who say, well, Ebola, there is no Ebola. It's a myth put in place by the government to get more funding from the West. And this is for me, it's incredible that you have this level of mistrust towards your government, and this is clearly an effect of the history.
It's not just in Liberia.
Yeah,
the same thing is happening in Guinea and Sierra Leone. Just yesterday in the news that some health workers were people basically just haul stone at them, and they've still not been accounted for. Who knows? Maybe they've been abducted by local villagers. The same thing happened in Sierra Leone when I was there. Basically, our car broke down in a village, and I went into this village, basically just trying to ask if I could borrow something like a spanner, and the parents were yelling at their kids to come back inside. I'm a Sierra Leonean, but just because I look foreign, and I was standing there in my home country, in a village before I would go there, and everyone would just come out and talk to me, or even hug me if I asked them to, and they were running away from me. They saw a car, people were passing by, they just like running past the car. They thought, oh, we are bringing Ebola to them. So there was that mistrust among the people.
Judith, President Obama calls Ebola a threat to global security. But if I understand your initial remarks correctly, you don't necessarily subscribe to that line of thinking.
Well, I mean, generally speaking, it is a threat beyond the region, definitely. And of course, it could spread to Europe or the US. And if nothing is done about it, it definitely can become a much bigger threat to other areas. But I think at this point, I mean, the main reason really to intervene in the way he does now, and the US does, really is to contain the disease there and help people there. Obviously, it also is necessary in order to explain to, in this case, the Americans, why are we sending 3,000 troops at this point abroad? I think in order to explain that and to justify that also, you have to kind of make clear that there could be a threat for us as well. And I'm not saying there is none, but I don't think it's the biggest issue.
And some people, Peter, Dörrie, are also asking, now we have this very, very high focus on Ebola, but when in fact diseases like malaria and tuberculosis and HIV kill several million people each year in Africa. Measles alone, sometimes we forget that, killed 120,000 people last year. Do you think it's disproportionate, this focus that we're having now on Ebola vis-a-vis the other diseases?
It depends on what kind of scale you talk about. If we're talking about Africa, and you mentioned that earlier, it's not threatening the continent. If you take a continental view, then diseases like HIV/AIDS, like malaria, are certainly more important. But for these three countries and for the sub-region, this is the big crisis now, because it's not only affecting health, it's also affecting the economy, it's affecting governance, as we just heard, because there's a general breakdown of the state in some ways. So I think it's not overblown if we look at the three countries most affected and at the risks for the neighboring countries. But you shouldn't make the mistake of talking about Africa as a coherent whole. So there's a differentiation there. And the other diseases, the other challenges shouldn't be overlooked completely.
The difference, I would say, is that malaria has been there for quite a long time. And HIV has also been there for quite a long time. And if you look at the rate at which Ebola is expanding, if you allow Ebola to stay that long in comparison to malaria and HIV, then the death rate is going to be like, 5 or 10 times than malaria or HIV.
But this is not the first Ebola outbreak in the history. In fact, Ebola itself also has been around for quite some time, hasn't it?
Yes, it has been. But the scale at which this particular outbreak in West Africa, just like you mentioned at the beginning there, it got that bad because people did not trust the information that came out. Local people thought it was a fabrication, complete fabrication. Up till now, there are a lot of people who do not believe or think something else, whether traditional practice, whether you blame it on something. There is still that denial that exists among people. You tell them not shake hands, they do shake hands. You tell them don't get too close to the person, they do that. An example again, when I was in Freetown, someone collapsed in the middle of Siaka Stevens Street. I was running away, but I was the only one running away from that. Everyone was running to the scene, trying to lend hand to that person who collapsed, because that's just the culture of the people. And you can't change that overnight. You can't. You can give out the information to people. You can tell them these are the preventive measures of Ebola, but you don't expect them to take it so quick. It doesn't happen that fast.
Judith, we've been getting some positive news from Africa recently, anyway. The economic revival and the youth, the African youth, is really blossoming, and education is booming up. And these kind of news, and especially this incident, of course, has thrown the continent, particularly these three countries, back in a very severe manner, doesn't it?
Well, we can already see that growth rates have been adjusted. There is going to be less growth in those countries in the months and year to come. But as Abu said before, of course, this now really is about containing the disease, because also that's at the root of this, these economic consequences and problems. But also, I think the as positive as those growth rates are, there still is, even before the Ebola outbreak, there was the problem that they don't really create that much jobs for particularly lowly educated people and young people, and they have very high expectations for their life to improve very soon. So I think there is a general problem even without Ebola, but that's really going to be a big issue for the countries, I think. Not just the economic problems, but I mean, we can already see that prices are really rising, not just in transport, but especially for food. There might be a food crisis coming, and people are dying already from diseases like malaria more than before. Even pregnant women, they don't get any kind of help, medical help anymore, or they don't go to hospitals because they're afraid. So there is more people who will be or are already dying because of other reasons that are related to the Ebola outbreak, and that needs to be tackled as well.
How do you assess Europe's role so far?
Well, I think, as I said, I think there's some organizations that are doing a great work. Doctors Without Borders is the obvious most important example, I think. Again, to be fair, there really is a problem. I know that some organizations really have problems deploying experts and people to those countries because they can actually not guarantee that they will get treatment if they get sick. And it's also insurance problems, all kinds of things. It's quite difficult to find people to send there, actually. But that is, I think, as far as I understand, the biggest problem right now, that money is coming, but then you have to spend the money on something, and you need expertise to spend it right. And you need people who know the countries, but also people who know Ebola and the ways to best contain it very well. So I think that's really the big problem right now. You need a very quick impact, but you also need a very good knowledge.
Peter, we've talked about the US efforts underway. We've talked about the European contribution. What about other African nations here?
I don't know. I haven't really heard anything about this. I think there's certainly some form of cooperation, for example, from Uganda, which has its own experiences with Ebola and which was able to contain an outbreak in 2012 relatively rapidly and without many casualties. So I don't know for sure, but I would think that they definitely are cooperating and sharing information and maybe also sending experts. But for the other countries, I think, especially in the region, who all haven't have the best health system either, they are, I think, focusing on protecting their population at the moment. For example, I know about Senegal, who has had one case, which was a man coming from Guinea, and they have immediately shut their border. They have immediately contacted the WHO, the World Health Organization, for additional support for material, for disinfectants and so on, but not so much to contribute to solving the crisis in their neighboring country, but to be prepared for the case that it's transmitted into Senegal itself. So, and I think this is legitimate. These countries don't have the capacity that the US has, that Europe has, and the governments, of course, have the task to protect their own citizens.
Abu, there's a nightmare scenario that the people are talking about, that as bad as the situation in Liberia, Guinea, and Sierra Leone is, we've had, from all accounts, we've gotten some isolated incidents in Nigeria. And they're saying if Nigeria is now being affected, especially in a city like Lagos, for instance, where it's pretty hard to avoid human contact, then we're really in big trouble here.
Well, we have been there. There's been a couple of cases in Lagos, but I think because of what happened in Liberia, Guinea, and Sierra Leone, that the Nigerian authorities were able to act very fast in order to put their system, their health system in place to contain the virus. And we haven't had any new cases in about a week or more than that in Nigeria. You would say they have contained the virus. You can't be sure absolutely, but you'd say, so since you haven't had a case, you haven't heard about a case in a week or two, you'd say they've been able to contain the virus. But then, for me personally, I think international community has to come in to support local government in order to fight this. But local authorities, the absolute burden is on local authorities to work hard and work fast. and put politics aside and put all of the issues aside and try and contain this virus. What I saw in Sierra Leone, I was absolutely devastated by what I saw. When it started, the government, the president did not act fast. He was absolutely very, very quiet about it. It took him about 4 or 5 months before he actually came out and made a statement or even visit the area where the outbreak started. That's in Kailahun. Before he came down there, and before he came down there, he distributed money among members of parliament in order to help in this fight. What happened, what I saw in Kailahun was, I said it was devastating because I saw these MPs basically come to the MSF clinic, stand in front, and then look at where it says, the sign says low risk zone, stand in front of this, taking selfies of themselves, and then walk back and say, yeah, we've been there, and we're trying to help in this fight. That's not enough. They have to develop behavior change models in order to get the people to change their mindset, to change their behavior, at least take extreme measure. That's what is needed to contain this virus. We need international help, but we need to be serious about getting this help.
I think that's a very good example of how the problems that are already there, you talked about governance already, are now getting worse, or actually they are a reason why the virus has spread that badly as well. And at the level of governance, talking about political elites, I don't want to join all those saying, everyone is corrupt in those countries and so on. That's a little bit simplified, but the Liberian president has just actually fired 10 high-ranking officials because they have been out of the country for weeks without permission. I understand personally they are scared as well, but she has fired them because people are in the administration. There is a lack of people who are actually engaging seriously in containing the virus as well and helping to fight the crisis at the various levels, because as we said, there are more consequences coming. So a good governance response is needed, but I must admit that I'm not so optimistic that there will be a very profound effort by most people in high positions. There are some who definitely try their best, and they are non-governmental organizations doing good work. But all the problems that we have seen in those countries before Ebola are now intensifying.
But I can actually commend Sirleaf's government so far. They've been able to come out clean, say they don't have the capacity. They're reaching out, writing personal letters to leaders, to not just European or North American leaders. They're also asking leaders in Asia. They've asked African Union to step in. They're asking support from everywhere, which is highly commendable.
I think you're both right. I think that the Liberian government has done a better job of this than the other governments affected so far. But there are still obviously challenges, and I think that if you look, for example, at the reaction of the security forces, then there's many of the challenges and issues that these countries had before now come to the fore. And you had confrontations in Monrovia between when security forces try to cut off a part of the capital to contain the virus there, and using policing methods which just amplify the conflict, and you actually had people getting shot because they tried to break out of this quarantine because the police and the army that were put in place couldn't handle the situation. And this is just the same thing we saw before the outbreak of the disease. They applied the same methods, but now it's getting a bit more attention because it's contributing to the spread of the virus and to the mistrust toward the government and authorities.
Yeah, Sierra Leone is basically putting, it's actually starting today, that they're having a 3-day lockdown of the entire country in order to contain the spread of the virus. I think the intent is there. The fact that they're doing something is a good thing, but it's not an effective measure because you can't keep people without providing food for them for 3 days. We've been in curfew in Sierra Leone, and just for a few hours, and it gets unbearable. You don't have access to food, and people live on, how do you call it, hand to mouth, basically, in Sierra Leone. Not just in Sierra Leone, in most parts of West Africa. And you don't expect those people to have food banks somewhere in their houses where they can survive for 3 days without leaving their houses. So
it's also a question, how do you want to enforce, even if it was a viable policy, how do you want to enforce it? I mean, the governments weren't able to effectively police all their territory before the crisis.
They can.
So how do they want to enforce something like a 3-day curfew?
They can, because the last night, the day before I flew out of Sierra Leone, there was basically a 1-day lockdown. I was in my hotel all day. I wasn't able to buy water or anything. That's something they can do. They can get police officers, soldiers out in the street, and people cannot go outside. That's something they absolutely can do. But you can't just lock people up for 72 hours without making sure that they have access to food.
Judith, what are the lessons to be learned here?
I think there's one really important lesson that is actually quite obvious, I think, but very difficult to implement in terms of learning. And that is that those coercive measures are usually not working, even if there might be an effect in the short run, even if it is possible to implement them. All organizations like Doctors Without Borders, again, are saying it's actually making things worse because the lack of trust is increasing, because you're locked into your home. You also feel stigmatized sometimes. You don't have food. We've already seen the results in West Point, which is an area in Monrovia in Liberia that has been locked down, and there has been some violence there, and food prices were, increasing over like hours just, and people just got really scared, and there was a lot of panic. And it already is an area in Monrovia that is kind of stigmatized as being problematic, a lot of crime, drug abuse and all kinds of problems. And there are already a lot of issues of how the state and society, the citizens are relating, and it's not getting better with those measures. So you need to rely more on community measures and involve people who actually are of importance in the communities. As someone said recently, it's it could be the priest, the chief, no matter who it is, but a person people trust.
Peter? About the lessons to be learned from this epidemic outbreak?
I completely agree that that sending the police to contain the virus is not going to work, and this is one of the main lessons that the governments can maybe also learn for the rest of their governance. That this is not always the best solution for a problem. I think on a more general level, I think. These countries, now that they had an outbreak of Ebola, and it's clear that it's not confined to Central Africa, I think that many African countries should look hard at their kind of preparation for these kind of diseases, and they should look at the lessons learned from outbreaks in Congo and especially Uganda, where, as I said, they had been able during the last outbreaks to contain this much more quickly and much more effectively. But in the end, it comes down again to the question of governance. So you can't just lay over a switch and say, okay, we will have a state-of-the-art disease prevention system now, because as we have discussed now, it's down to the basic malfunction of the states in these cases. And Uganda has a stronger state, so they are able to cope with these kind of crises better. And I think for Sierra Leone and Liberia and Guinea, it's a question of improving their governance on a whole, and taking this as a warning that weak governance and a weak state and corrupt governance is not only a problem economically, but it can also go to the very heart of society in some cases.
Absolutely, I agree with that, and I think the political landscape has to change, not just in Sierra Leone, but also in Guinea, Liberia, and the whole of sub-Saharan Africa. The political landscape has to change in a way that, as we call it in German, Feuerlöscherpolitik, that they do there, it has to change. People have to have...
Fire extinguisher politics.
Yeah. They have to have strategies in place, not just for health emergencies, but also for security threats, for outbreak of famine, for example, that people are being afraid of at the moment in South Sudan. Expect that everywhere in sub-Saharan Africa, something like that can happen. And authorities, they have to have things in place, modalities in place to respond appropriately not just act when something happens.
Do you think that this outbreak, for lack of a better term, might even have a positive effect in that people will start questioning the political system?
You can say that's the silver lining in it, if you want to look at it from that point of view. But then you can also say, for me, at the moment, I don't think beyond anything. I don't think along those lines. I only think about things that those authorities have to do in order to contain the spread of this virus. Because every morning I wake up, I think about my family and friends back home, and it's terrifying. When my mom and my sister is sick, they're afraid to go to the hospital. Or when you go to the hospital, the first thing they have to do is do an Ebola test. And they don't just do the test right away because they don't have the capacity. They only have one laboratory. The lab is in Kenema, and they live in Bow. And when you go to the hospital for a test, you have to wait for more than 24 hours to get the result back. So it means if you have a headache, serious headache, someone is dying, it means they do the blood test first. It means you have to wait. Who knows what is going to happen between that 24 hours or 48 hours period. When we only have one neurologist in Sierra Leone, and if that neurologist has to do surgeries in Freetown, someone is sick, seriously sick, they have to do tests for Ebola first, because they don't just rush the people. That's the new measures that they're doing. Absolutely good. They're trying to build a lab in Freetown, but it's not finished yet. It's been going on for about a month now. It's not done yet. But then they have to do things really fast. They have to work. They have to work really fast in order to prevent people from dying from other sicknesses, like we said, malaria or HIV, which are basically totally be ignored now. Those who are getting sick, dying from malaria, they're not getting the kind of treatment they need anymore because the entire resources of these affected countries are being placed to fight Ebola.
So one rescue effort comes at the expense of the other. Then, Judith, Germany is often being perceived as the engine of the European Union these days anyway. Should and must Germany do more here?
Well, definitely one should do more. At the same time, I think it's not just about spending more money, which right now is kind of the way it goes. I think that's not just not sufficient. There's also the danger of pouring a lot of money into a system that is not functioning. I think we have to be aware of that. So I think what is needed is really expertise and personnel going to those countries, trainings, and in the direction of what the US is doing now. You can debate whether it has to be the military or rather civilian personnel, but there Germany should definitely do more. But we need to be careful about what we are doing as well.
The WHO, Peter Dörrie, says this can be contained in 6 to 9 months. Are they too optimistic?
I don't have an idea. I don't know if they are too optimistic or not. I'm not a medical expert, so I can't really say anything about how realistic that is.
But you know the political circumstances and the societies over there. Do you think that seems realistic?
I think it really depends on the level of investment that is made now from the international community. I think it has been clear that the countries themselves don't have the capacity to contain it, and this is just like it is. They come from a civil war scenario, so we can't expect them to contain it themselves. And I think the international community is now has to take up the baton and there are several countries which should follow up on the pledges made by the US, which I think go a long way towards reaching that goal of containing the spread of the disease. And I think that the European Union is especially should feel compelled to react on a similar scale.
But what is your hope? What gives you hope amidst all the despair and the horrifying visions we've been seeing?
What gives me hope is the people, the dying desire of people who are on the front line fighting. When I was reporting from Sierra Leone, I followed the activities of these people, and I saw what they do. For example, I was following a guy who's part of the surveillance team. Every morning he wakes up, takes his motorbike, and drives. And then you have these contact tracers. These are young high school boys who are still in high school, and they are risking their lives. Every day they walk 7 miles. That's about 10, 12 kilometers. Every day just to trace a contact, ask how you're doing. These are the people that give me hope. their work that they do, that gives me hope. But looking back into the capital cities, what is happening doesn't give me hope at all.
Judith, is this outbreak perhaps also a bit of a wake-up call for us in this part of the world, for Europeans, for Americans, that we need to increase our attention and investment when it comes to Africa?
That might be one.
Not just when an epidemic breaks out, but in general.
Right, that might be one aspect. One thing I think is true, you're right, we should not just see what is not functioning and the problems in the capitals and the governance problems, but what is actually working and what important things the communities are doing. I've been hearing that they really, not just stay together, but they really try to contain, now at least, they try to help containing it in their communities. And
do we need a global strategy when it comes to Africa?
Well,
not just Ebola, I'm talking about Africa.
I don't know whether it really is about a global strategy. I also don't think it's really about more money, more aid, no matter what. But what we can see is that Liberia and Sierra Leone have been seen as very positive examples of peacekeeping and building after the civil wars. And I think we have to see the positive and negative aspects more clearly.
Well, that we certainly do. The positive and the negative aspects. The negative, unfortunately, outweigh, so far anyway, when it comes to the Ebola epidemic outbreak. But there is hope, there is a silver lining with the latest initiative by President Obama. I want to thank my guests for their insights into a very important subject matter. I want to thank you out there for tuning in, of course, and we will continue to follow this story as it unfolds. Looking forward to seeing you again next week for a new edition of Quadriga.